Hi, good morning, Kane. My name is Mihira. I'm your invigilator for the OET-speaking session on the 4th of August 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record please?
My full name is Kane Honer.
And what is your candidate number, please?
My candidate number is 252525525.
Thank you. Are you taking this test as a nurse?
Yes, I am.
All right. Can I see your ID, please?
Sure. Here it is.
Okay. Now, let's move on to warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihira.
Tell me about yourself and your nursing background.
I am a compassionate and dedicated nurse with 5 years of experience in various healthcare settings. I graduated with a Bachelor of Science in Nursing and have since worked in a fast-paced hospital environment, providing patient-centered care and collaborating with multidisciplinary teams. I am skilled in administering medications, monitoring vital signs, and ensuring patient safety. I find fulfillment in making a positive impact on patients' lives, and am committed to continuous learning and professional growth in the nursing field.
How do you handle stressful situations in a healthcare setting?
In the healthcare environment, stress is common, and I've learned to manage it effectively. When facing a challenging situation, I prioritize patient care and maintain a calm and composed demeanor. I rely on my strong communication skills to collaborate with colleagues and share the workload when necessary. I also find stress relief through regular exercise and seeking support from my nursing team. Remaining focused on the task at hand and understanding the significance of my role in patient care helps me navigate stressful situations successfully.
Describe a difficult patient encounter you've had and how you handled it.
During one of my shifts, I encountered a patient who was anxious and uncooperative due to their fear of needles. I took the time to sit with the patient, actively listened to their concerns, and empathized with their fear. I explained the procedure thoroughly, outlining the benefits, and reassured them that I would be as gentle as possible. To alleviate their anxiety, I used distraction techniques and allowed the patient to have control over the pace of the procedure. By building trust and demonstrating understanding, I successfully completed the procedure while ensuring the patient felt respected and cared for.
How do you ensure patient safety and prevent medical errors in your practice?
Patient safety is a top priority in nursing, and I follow a systematic approach to prevent medical errors. I double-check medication doses, compare patient identifiers, and use barcode scanning to verify medication administration. I also maintain accurate documentation and communicate effectively with other team members during patient handoffs. Additionally, I stay up to date with the latest evidence-based practices and participate in ongoing training to enhance my knowledge and skills, ultimately reducing the likelihood of errors and promoting optimal patient outcomes.
How do you handle conflicts or disagreements with colleagues?
In a collaborative healthcare environment, conflicts can arise, but I believe in addressing them constructively and professionally. When facing disagreements with colleagues, I initiate open and respectful communication to understand their perspectives and concerns. I actively listen to their points of view and share my own in a non-confrontational manner. If necessary, I involve a supervisor or mediator to help resolve the issue. My ultimate goal is to maintain a harmonious working relationship with my colleagues and ensure that we can all focus on providing the best possible care for our patients.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihira.
You have up to 3 minutes to prepare the roleplay. You will start the roleplay after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the roleplay card if you want to. Here's a pencil for making notes.
Thank you, Mihira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. The roleplay will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the roleplay, please?
Good afternoon. I am Nurse Kane Horner. Welcome to our clinic. How may I assist you today?
Hi nurse, I'm feeling really tired and have been having some issues with my feet lately.
I'm sorry to hear that. Don't worry, we will help you. Well, before proceeding, may I know your name and age for the records, please?
My name is Mihira, and I am 52 years old.
Mihira, let's sit down and discuss your symptoms. Can you tell me more about what's been bothering you?
Well, I'm working long hours in customer service. My feet ache a lot, and sometimes I experience numbness and tingling, especially at night. My memory hasn't been great either, and when I get stressed, my hands shake.
I see. Mihira, it sounds like your work is quite demanding and stressful. Long working hours and stress can definitely contribute to tiredness and memory issues. Regarding your feet, have you been wearing comfortable shoes, or tried using compression stockings?
Yes, I've tried some comfortable shoes, but they don't seem to help much.
Alright. It's essential to take care of your feet, especially given your busy work life. I would suggest considering orthopedic shoes, or other options, that provide proper support and relief for your feet. Also, try to elevate your feet when you can, to reduce swelling.
I'll look into those options. But honestly, I feel like I'm always under pressure at work. The pace is so frantic, and I have to remember dozens of things without writing them down.
It's understandable that you feel overwhelmed with such a demanding job. Remembering so many things, without writing them down, can indeed add to your stress. Mihira, it might be beneficial to find ways to prioritize tasks, and possibly use some organizational tools to help you manage your workload better.
You're right. I guess stress could be contributing to my symptoms.
That's a possibility. We'll certainly address your foot concerns, but I also recommend you see a podiatrist for a more specialized evaluation. They can offer personalized advice for your foot condition.
I agree, a podiatrist might be helpful. But there is something else I need to mention.
Definitely, Mihira, you may please go ahead.
Nurse, I'm really worried about my family history of neurological diseases. My uncle has multiple sclerosis, and my aunt has Parkinson's disease. I can't shake off the fear that I might have something similar.
Mihira, I understand your concerns. It is quite natural to feel so. But it's important not to jump to conclusions. Self-diagnosis is not advisable. Family history can be a risk factor, but it doesn't necessarily mean you will develop the same conditions. It's best to consult with a doctor who can assess your symptoms and order any necessary tests to provide a clearer picture.
You're right. I shouldn't self-diagnose. I will make an appointment to see a doctor.
That's a wise decision, Mihira. Remember, stressing about potential health issues can worsen symptoms and lead to unnecessary worries. Let's focus on addressing your immediate concerns with your feet and memory, and then we can proceed with the referral to a doctor for further evaluation.
Thank you for understanding. I'll do as you suggest, and try not to worry too much until I see the doctor.
You're welcome. We're here to help you, so feel free to reach out if you have any more questions or concerns. Take care, and we'll take it one step at a time.
I appreciate your support. Thank you. That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.